First, talk about your capacity, where it is in the hospital, and your access to resources like quality staff and protective gear.
Thanks very much for having me. So I would tell you that, since that stat you quoted, we're now at 150% in the last 15 days in terms of patient volume for COVID. We now have just over 320 patients across our hospitals. That's about 10% of the population across the entire state of Michigan. Our concern is this. While that volume is spread across 5 hospitals in southeast and central Michigan, the rates are continuing to increase. Our emergency departments are becoming more and more full on a day-to-day basis with patients waiting and those needing to be admitted for COVID. We have one hospital that has more than 50% of its volume that's now COVID related. And one of the big concerns, as you mentioned, is staffing. And so clearly, Michigan has been hit with the COVID pandemic since March. And so we have a significant number of staff who have been working pretty hard for the last 8 months. Would tell you that we're seeing shortages in critical care nurses. We're seeing shortages in some of our support staff, like environmental service workers. And so it's becoming very concerning for us. And the last point I would make to you is that generally speaking, we're seeing more and more of our staff that are getting community spread from COVID. And would tell you that as we began this process, we had about a 3% positivity rate with our employee staff. Since Friday, the number of staff we've tested, our positivity rate has gone up to 20%, both with the employees that we've tested and with our overall population positivity rate within our lab. And so we're very concerned about spread across all of our communities.
That's an incredibly alarming statistic, right? And it brings me to my next question, which is, as we cover the expectation of this vaccine and the fact that frontline workers will be among the first to be vaccinated by the end of this year, are you queuing up to get that vaccine, one of these vaccines, for your workers? And what are you being told about its availability?
Well, there's still not a lot of clarity yet on the availability. We certainly are making preparations. We are an organization that, because we have a lot of research going on in our healthcare system, we have the freezer capability to store the vaccines that need storing at 80 below 0 Celsius. And so we're preparing for that. We are working very diligently with our state public health officials in terms of distribution. And so we will be prepared as soon as there's clarity at the state level regarding how many doses of vaccine will be available for the state of Michigan. And so our chief medical officer is meeting with the state on a regular basis to get information around our preparations. And so we will be prepared for the vaccine as soon as it's available.
Right. When it comes to supplemental staff coming to you from other parts of the country, we asked some healthcare CEOs in Wisconsin last week about that, and their response was that they're not expecting any. They said, we're on our own. What's your view on where you would get help if you could get help?
So we're greatly concerned about that issue. Back in March when we had challenges, we were able to get staff from Ohio, staff from California, and so we felt that we were in pretty good shape with backup staffing. At this point in time, it's very, very challenging. The agencies that provide supplemental staffing are strained, and as you might imagine, in a supply and demand economy, the rates for that continues to increase. I would tell you that we have relationships with 2 organizations in different parts of the country where the 3 of us have agreed to share staff if one of us gets into challenges. And so I am hopeful that if we are in a need for that, we will rely on our partnerships with organizations in the New York area and organizations out in the Mountain West to potentially provide support for us. And we would do the same thing if they were to get in trouble.
Well, I guess, right, my question would be then, how far are you from getting into trouble, so to speak? I mean, how much space do you have between now and then?
Well, the data in Michigan would suggest that hospitalizations could double over the next 3 to 4 weeks. And if that were to be the case, we would clearly be in a scenario where we would need supplemental staff and would be reaching out to colleagues to the agencies that staff us on a regular basis, but also to colleagues in other parts of the country. And so our human resources team are actively working on plans to provide supplemental staffing should that be the need.
Shepard Smith here. Thanks for watching CNBC on YouTube.